Hello, everyone, and welcome to today's webinar. We're so excited to have you here with us today for our webinar series, where we're going to be showing you how to turbocharge your practice with eClinicalWorks analytics features. Today, in particular, we're going to spotlight the MIPS Dashboard and the Provider Hub. This is part 2 of our 3-part series, so if you missed the last session, we covered the safety and compliance dashboard. We have that recording out there, so if you haven't had a chance to watch it, we'll make sure to send you that link again today. And then as a reminder, next Thursday at 11 a.m., we are going to discuss EBO reporting and the PM analytics dashboard. So you don't want to miss that session, and we really hope you can join us. As for your speakers today, that includes me, Caitlin Hausman, the Marketing Communications Manager here at Referrals. So I'm going to be your organizer. And then joining me, we have my colleague, Tiffany Richardson. Tiffany is one of our certified eClinicalWorks trainers, and she also brings previous experience as a registered nurse to our training team. So we're really excited to have her on the line. But before we jump into the MIPS dashboard and the Provider Hub, if you haven't heard of us, or if you're wondering why we're talking about eClinicalWorks, that's because we are eClinicalWorks experts. If you don't know the name Revel, you might know us by our former name, Group 1 Health Source. We're actually rebranded just last year, so some of you may not be quite as familiar with our new name and look, but we're still the same company. We have eClinicalWorks training and billing experts in offices across the United States and across India. We've been around for 25 years now, a little over, I think, and we've seen really how complicated healthcare reimbursement has become. So we've set out to make all of that easier for our customers. We help a lot of eClinicalWorks users fix some of the problems that could be keeping you up at night, things like inefficient workflows or just poor adoption. We work with those clinics using ECW to maximize its capabilities. In addition to that, we also provide revenue cycle management services, and that is an end-to-end medical billing service where we really pair our eClinicalWorks training and optimization with the revenue cycle side. Again, if you're not looking to outsource the full revenue cycle management operations of your clinic, we do take on some one-off projects where we'll do AR cleanup and a lot of consulting, whether that be for eClinicalWorks or your medical billing. So if it sounds like something you're interested in, we'd love to hear from you. You can reach out to us on our website or reply to any of the emails you've received about this webinar. And then I do want to cover a few just housekeeping items here. We have a Q&A box, so you'll see a Q&A box on your screen. You can use that throughout the webinar to submit any questions you have for Tiffany, and then we'll get to those at the end of the session. And then we also are recording this, so keep an eye out for that email later today. And I think that's all I had, so I'm going to hand it over to you, Tiffany.
Thank you, Caitlin. I'm going to, and thank you for everybody attending. I'm going to display our trainer database. All right, so today we're going to be reviewing, like Caitlin said, the Provider Hub and the MIPS Dashboard. I'm going to demonstrate it in our trainer database. So we're not in a live client database or anything. So all these patients are test patients in a training environment. So of course, with it being a training environment, some of this information is not live, and it's not going to provide the level that you may see within your own data set. So in order to access your Provider Hub or your MIPS Dashboard, as we had mentioned, we're doing the analytics series. So we're going to go to the analytics dashboard, and then we're going to start with Provider Hub. And you'll see 6 options, what they call cards, in the Provider Hub. We have today's outlook, quality metric, operational dashboard, ACO measures, PQRS measures, and clinical quality measures. The bottom 3 cards, we're not going to be able to display in the trainer database, as this is not a live environment. You may have this functionality enabled in your software in order to access those 3. If you just click on it, it'll tell you what you need to have activated in order to connect it to those measures. So for like population health management, you would be able to see what measures that you're associated to as the provider and determine what measures need to be completed or worked on. Same thing for PQRS measures, and then the clinical quality measures, again, product activation, clinical quality measures. Some of these are not going to be in, if you go to your admin product activation, you might have to contact your SAM to be able to show some of these, to get these activated, because some of them are not going to be in your product activation window. So just FYI on that one. All right, so let's go back to the Provider Hub. So the 3 areas that I'm mainly going to key on is the 3 top areas of the Provider Hub are going to be these 3. So if I go to today's Outlook, I can look and see how many patients I've got scheduled for today. So I put a bunch of test patients on the schedule to show that you can see all those patients that are scheduled for your office visits. You can show any canceled appointments. You can show if there's any new patients, any repeat patients, and then upcoming patient appointments as well. You can look at today, tomorrow, and a 5-day forecast. With the appointments also in this window, if you look over to the right, you show the today's appointments, but you also have patients with chronic conditions. If you select that, it's going to give you the bubbles to identify what kind of risk management and chronic conditions have to be managed with the patients that you're seeing and your today's visits. You can then filter by all patients. You can arrange them by risk. So if there's low risk factors, they're going to display on the left. High risk factors are going to display on the right. And then when you hover over, it's going to give you the patient gender, age, and what their chronic condition count is. You can arrange by age as well. And then that's going to give you what age groups and what conditions to be aware of for the patients that you're seeing today. If you select opportunities, if you have those opportunities set up, you can then see what screening has been completed, if the wellness visits have been conducted for these patients that you're seeing in the past year, so that you can ensure that that gets scheduled for the year. And then you also have the option for overstay. And then overstay just kind of lets you know, like if your resource schedule rule duration says that your follow-up visit's going to be, say, for instance, 30 minutes. If the patient's there longer than 30 minutes, it's going to let you know how you've been doing with your overstay, the amount of time that you're spending with your patients. So you can see here over the last 3 months, you can see left on time, 2 appointments, incomplete data, 9 appointments. So you can kind of see a percentage value. This Provider Hub dashboard is still, it's relatively new. There's not a lot of documentation out there available for it, but I believe it's something that ECW is in the development to improve and connect some of these, the functionality of the system, so that it allows providers to work a little bit more effortlessly during their day to kind of make sure that they get some of the measures and stuff that need to be completed. The last piece is the operational, oh, excuse me, I forgot the quality metric, kind of skipped over that. So we go back to quality metric, and we have the EHR use measures. We can see the office visits. We can hover over the areas, and I'll tell you, like the last 6 months, how many percentage of allergy structured drugs, percentage of electronic prescribing, the percentage of blood pressure that was entered. Of course, this is a test environment, so this isn't going to get the information that you would in your own environment. If we click on the eye over in the left top corner, it's going to give us the legend on what the areas, the different colors mean when you're looking at the data. So above my community average, you can compare it to above the measurement unit target, and then below my community average. And then some recommendations as well. And then if we go back to the Provider Hub, we have the operational dashboard is the 3rd section, the 3rd card, and then you can see your waiting time, average waiting time for your patients, any cancellations, the average number of cancellations you're getting, the time before they're canceling their appointment, the average number of appointments you have per day, the number of telephone encounters that you have assigned, and then the drugs that you're prescribed. Are you prescribing branded, generic, or unknown? So those are some additional options that you can see within your operational dashboard appointments window. And then you also have the the geospatial analysis, and then select Run Now, and you can see the radius of your patients within your practice area. So really quick, Provider Hub wasn't going to take very long, just because it's still in that implementation phase. And as it develops, I feel like there will be a lot more information available here, especially to track if you're reporting for MIPS and your quality measures, and having these dashboards linked to the measures that you already have set up in your environment. Excuse me, your environment, you'll be able to identify that information more effectively. Now I'm going to skip on over to the analytics, the MIPS dashboard, because there is a lot more involved in that. And Provider Hub was just kind of like an insight to what to expect as it is developed along the way. The next is a MIPS, and then there's of course MIPS submission. If you have ECW consulting services, you may have the MIPS submission where they submit it, and that's where ECW submits it on your behalf if you have that in your contract, and you'd be able to see what years have been submitted for yourself. If you go to MIPS itself, we're going to look at the MIPS dashboard. And it'll take a moment to load. It's been a little sluggish the last few days. Something to note with the MIPS dashboard using ECW, it only extracts, ECW only extracts it on the weekend. So around Friday evening is when they extract the data. So if you make any major changes to your MIPS dashboard, you will have to wait until Monday to see the reflection of data that was extracted over the weekend. We'll go over the setup, how to set your quality measures, how to view your PI, and some of the other areas once it finishes loading. And this is the browser environment, or 11E as we also call it. You can access the MIPS dashboard within the EXE environment, and in order to access it, you would go to reports. You know, of course, in EXE environment, reports is going to be across the top, but you're going to go to reports and then report console, and then scroll down to macro, and then you'll find the MIPS dashboard there as well if you're in the EXE environment. All right, so it takes us right to the customer notification page. We're going to go over to the setup option, and we're going to select the year that we want to set up. So I've already set up 2020, but just to show you, so the data is extracted. As I said, it's only extracted over the weekend. So if I had not had already set this up, you would not see any data here at this time. You would, if you've already set up the years prior, you're just going to apply the waiver consent to set up the current year, and then it should populate all your providers. Of course, these are all, this is a test environment and test providers. You can change your TIN number. I do want to mention, if you change your TIN number, it's like as if you're resetting it up. So a lot of the settings, like your quality measures or anything like that you've set up, will have to be reset. If it is not refreshing properly, sometimes if you go down here to the bottom left and you select the provider type and change it and then revert it back to what it was prior, sometimes that'll force the system to update if the information is not being updated, even though you know it's been extracted. In this window, the other important, really important area, if you have other team members in your group that you would like to manage some of the MIPS or reflect on the data that's available, you're going to have to give them access. And this access has to be given every single year that you set up the MIPS dashboard. And it is only done in this window, and only an admin has the ability to add additional users to start with. Once they've added those users, another user, if they have, depending on what access they've given, they would have the ability to add other users, and I'll show you that as well. So if we select the providers, and then we select user settings, and this is where you're going to give permissions to your staff to use and view the MIPS dashboard. And as you can see in here, you will look for your staff member that you want to give access to. You'll see the different columns: setup, quality, promoting interoperability, and the IA. You will have to give them access to each of those sections that you want them to be able to view. If you do not want them to have the setup access, meaning that they could change the provider type, the specialty, the TIN number, anything on that setup window, if you give them access, they have the ability to do all of that, include giving other users access to the MIPS dashboard. The quality is going to give you the quality tab, which is your measures, your quality measures. The PI is going to give you the promoting interoperability, and then the IA, of course, is the IA over here. So by selecting those options is what options the staff will have access to. And again, that has to be done every year. So every year when you set up your MIPS dashboard, you're going to have to give that access to those users once again. The next section we want to look at is the quality measures. So if we select on the quality measures, we can then view the quality measures that have been assigned. And of course, it's going to show me the 3 providers and select OK. And I'll go into this a little bit deeper on what you're viewing here, and as well as how to set these quality measures. Because when you set up your dashboard, you go into this quality measure window, it's going to be empty. And so to set that up, you're going to have to go back to setup, select your provider, and then select quality measure selection. And it is grayed out. Why is that grayed out? Wasn't grayed out earlier. There it goes. Okay. So select your provider, select quality measure selection, and then select your provider's name. And then you will see the ones that have been selected. If you need to change it or add any, you're just going to select edit. And then you're able to go in and adjust your quality measures that you're wanting to assign. The MIPS dashboard, there is no cost to actually using the MIPS dashboard. The cost is in the in having ECW consulting services. That piece of it, there's a cost. But to use the MIPS dashboard itself, there is no cost to use it. You can verify if you're looking to maybe see how you're progressing and maybe want to use it next year. It's a great opportunity to kind of see where your practice sits with measures that you may or may not be reporting for. You also have the 7-point cap, the outcome, intermediate outcome, inverse measure, high priority, and we'll discuss that when we get into the quality measure area as well. One other thing I want to mention is you can see that these are set up with individual reporting type. So you can see individual, individual, individual. There is another reporting type as group, and depending on whether it is a group setup or an individual setup is how you will select going into the quality measure. So if I go into the quality measure, for instance, it's going to show me the providers because I'm an individual setup for the MIPS reporting. If I was set up as a group, it's just going to give me a 10 number, the tax ID number. And then I would just select, and then it's going to show me those measures. And again, this has to wait till the data extraction over the weekend. So after you set this up, you're going to have to wait until Friday when it's extracted, and then Monday that data should be available for viewing. The other filters that sometimes you may have to select is you may have to change it to registry or EHR depending on your setup. You might have to check if you are individual or group, you may have to select one of those in order for it to filter correctly. The search between dates are automatically generated. And when ECW does their data extraction, this is the date that they have for the data. So at the end of the year, if you are reporting for a third-party group for MIPS, you may have to request that ECW do a data extraction for like the last quarter or the third quarter or whatever quarter it is that you would like to report for, so that you can get the more specific data range. But that has to be requested from ECW to extract that specific range. We also have the PI measures. So if we go over to the PI tab and select 2020, we now can view the providers that are listed here. Select OK, because this is again individual. If it was a group setup, you would see a total number for all the providers, whereas individual is just per provider. You can see their e-prescribing, their referral loops, and the access to health information. And I'll briefly go into how this is kind of mapped in the system and how it's met. And then the last section is your IA. And I'm going to select providers, and then it just, you have all of your IA initiatives here as well, that you can look at those numbers, look at your total score and how you're doing on that side. All right. Now let's go back to quality. And I'm going to briefly go over how the system reads some of this information, because all this stuff has to be mapped somewhere. It has to be coded so the system knows, where am I getting this data? How is this data populating? Where is this data coming from? So ECW has many guides out there on each individual measure that they have built into the system and how it's set up. Each measure is different in the way it's mapped in the system. Some of them have the same areas they're mapped in. So if it's a lab related measure, like a colonoscopy for colorectal screening or a mammogram for a breast cancer screening. Depending on how you order that, how you document it, and how you map it is how it's going to report that data. If you hover over the sections, like for the denominator, I'm hovering over the one, it's going to give you a little bit of information on the measure itself for the denominator, and then also for the numerator, and then where that description of that data may be found. Again, if you hover over each section, you get a little bit more information, and then of course the decile, where you fit in that decile range as well for that measure. There's multiple areas where this can be mapped. I'm just going to briefly show you one of the main areas that mapping is completed for some of these sections. We're going to go up to menu. We're going to go to community. We're going to go to mappings. And a lot of these will go into the same window. So if I go into labs, for instance, it's going to take me into the same window for labs, DI, procedure. So no matter what I select in my menu bar, it's going to take me to this window. And I can navigate easily from each section from this window without having to go back in and out of the menu bar. So when I talked about mapping, so for instance, your lipid panel, if you had like the cholesterol screening, you could map your lipid panel to your local lab, which would be your lipid panel, or lipid profile. I've seen different practices use different labs, and so it's not triggering. I've seen that often where it's not triggering that they've ordered that lab, and it's not triggering that that measure was met. And the reason is because whatever order the provider is placing is not mapped as a community mapping to drop that numerator that it was met. For your labs and your diagnostic testing, the results from that order have to be received and reviewed in order for the system to trigger that that measure has been met. So when you look at the lab and you mark that it was received and reviewed, that's really important. Both have to be marked in order for it to link to the MIPS dashboard that it's been met. There are some structured data elements as well. So you probably know with your smart forms, I'm sure a lot have seen like your smoking cessation or your audit C or your depression screening. A lot of those are already mapped in the system, but if they are not, you have the ability to go and map those manually as well. If it's not mapped the way that you would like, if you would like it to be mapped in a different section of the progress note, you have that functionality as well. When you're looking at this window, just note that this is community. So this is what the system is mapped in from the MIPS dashboard. So kind of think of it like that. That's how the MIPS dashboard is pulling that data. And the local on the right-hand side is the information that it already exists in your system. And that'll tell you where you would need to document in the note. So if it was an HPI section, in order to meet that requirement, you would have to document into that section in order for it to map that it has been met. So go into the PI measures, and I'll come back to quality measures, and I'll show some of the documentation to show how you identify where those mappings are done. And it's pretty involved, and I don't have the time today to go through every single measure because every measure is different. And as I said, it's pretty involved on how it's mapped in the background. And there's a multitude of ways that you can drop those codes and get that measure met through that mapping. Let's go over to the PI section because that one's pretty straightforward. So e-prescribing. E-prescribing, for the denominator, it is any electronic prescription that goes out for anybody that is part of that is eligible for MIPS reporting. So any of the electronic prescribing that goes out is going to trigger for the denominator. Of course, we can't do electronic prescribing in our database, so ours is obviously going to be 0. But yours will likely have a larger number there. The numerator is how many times that for all those medications that were sent, how many of them had RX eligibility ran prior to that medication being sent. And it stands within 4 days. It holds that RX eligibility for 4 days prior to that medication being sent. You should have automated processes hopefully set up in your PM schedule tasks to run RX eligibility for your patients for the day, to run the night before, that morning, few hours before your day starts, to run RX eligibility on all your scheduled patients. There is a practice default that you have the ability to run RX eligibility on telephone encounters and new patients. And then the only one that you really have to be concerned with, where we see the numerator does not populate, where it's missed often, the RX eligibility is not being ran, is generally on the refills. So from the e-Jelly Bean, if your providers are refilling medications, those RX eligibility have to manually be ran for each one of those patient medications that are refilled. And that's going to trigger your numerator. Your referral loop, you have referrals incoming and outgoing. So the incoming is that you are receiving the electronic records, that you're doing the transition of care, you're identifying the problem list, you're resending the documentation to the provider, and this is all electronic. So faxing is not included in this data. It's only electronic records. So generally it's through the P2P or the HIS network that you are able to send electronic records back and forth, including medical records, referrals, and so on. The outgoing is that you're sending those referrals through a peer-to-peer network. That is for the denominator and numerator for both of those. And then the fourth option is the provide patients electronic access to their health information. This one, the key here for the numerator, if you show 0 in the numerator and you have a number in your denominator, it is likely that you don't have the FHIR activated in your interoperability hub, and it is required to have it activated for the system to trigger that the numerator was met for those patients. So if you go to admin product activation, and then you go to your interoperability section, find it. Here we are. And then you're going to want to make sure that the FHIR, FHIR, there's Commonwealth and Care Quality. You can have them activated as well. But the FHIR has to be activated in order for the numerator to populate. This is a training environment. It's not a big deal for us since we're not reporting, obviously, for anything. So it doesn't matter that ours is not selected. But you can have all 3 of them if you choose to have so. There is no cost to it from my understanding. From what I've known of the interoperability hub, there's no cost to have these activated. So the only thing I do recommend is make sure that your patients are aware that you're using these interoperability hubs to share records. Let's go back to the MIPS dashboard. And the other part of the PI measure for the access to the health records for your patients is web enabling them. So when you're in the resource schedule, I'm going to just jump over there because the MIPS dashboard is going to take a moment to load anyway. So let's jump over to the resource schedule. From the resource schedule, when you click on a patient's appointment, you have this option for email. There is an item key that requires this to be entered. If it is not entered, you will get a pop-up that displays that says that it is required. And you have also an option to list a reason if the email address is not there. This has to be done on the first appointment for the reporting period or for a brand new patient. They have to be web enabled or give a reason in that the first appointment for the reporting period or that patient's first appointment with the practice. And if that occurs, then that is going to trigger the numerator along with the FHIR interoperability hub that you have completed the numerator piece of the PI. Pull up, and I've got a couple of guides. I'm going to use the colorectal screening as an example of how to read a guide from ECW. That's loading, and I'll show you this real quick. So if you go on to eClinicalWorks, their support portal, there's a section for MACRA for MIPS reporting, and you have each one of them will have your MIPS registry reporting requirements. So this course says 2020, so this is this year's colorectal cancer screening. If we scroll down, we can see who's involved, who's part of this denominator, so what age range for the denominator, and then what codes are used to identify that are going to trigger the denominator. So your E&M codes that are going to trigger the denominator that is that patient's going to report for MIPS reporting. You do have exclusions, and this is basically telling you how and where you can document an exclusion to trigger the system that the patient is excluded from that criteria. So in the assessment window, in the problem list. You can document an onset date. Any of these ICD codes are used. It's going to document an exclusion. Same thing here. Any of these CPT codes is going to document an exclusion for that. Same thing in these sections. So not all of these have to be utilized in order to document an exclusion, but these are just different sections that you can document that's going to trigger the MIPS dashboard that that patient's excluded from that measure. So I'm going to skip on down because numerator is usually the more difficult mapping. So going past all the exclusion material, we're going to go down here to numerator criteria. So if we look at our numerator criteria, we can see you can do the occult blood stool test, that's a lab. So these are just different ways that it is mapped in the system where you can map it to trigger that numerator that it's been met based on the fecal occult blood test. Same thing with this one, it's recorded as last done because there's a historical value within ECW as well when you're looking at your patient's record. And if we go to CDSS, there we go. And then you have an H over here where you can record a historical data. So by documenting a historical date, it also will trigger that it's been met. Go back to here. So that is, you have, of course, the stool card test, you have the different types of CT tests for the colonography, the sigmoidography, you have your CPT2 codes that you can put in. So there's multiple ways. When I mentioned that there's different ways to map each one of these, there's so many ways to map it. And I point this guide out because it's going to assist you. And each one of these measures has a different way. You may decide after looking at it that you want to do it all in the same section of the note. That is completely possible. Just have to determine what the providers prefer on their documentation process. So again, last done colonoscopy, and that's going to pull all your numerator information. So, and all of these are really lengthy, and you can find them again, as I said, in your eClinicalWorks, and I'll show you that because it is a valuable area to look at when identifying. So from here, my eClinicalWorks support portal, click on knowledge, then you're going to click on macro, and you're going to go over here down to documentation. And then when you're in your documentation, you have all of the different areas that you can look at. So you can click on quality, you can click on MIPS Dashboard, that shows you some of the setup. Here's the quality measures, and all of those, that guide I just showed you, and all the guides you will be able to find. It's going to take a minute to load because it's such a large group, but you have all of the measures for 2020 here. So you can go in here and look at your measures and identify what is required, where is it mapped, you know, for the numerator, the denominator. And again, while you're inside of the MIPS dashboard, if you hover over the sections, you can see kind of where it's triggered as well. For your measure setup and parameterization, if you go to menu and you go to EMR, and I believe, yes, CDSS, that's what I was thinking. All right, EMR, and then you go to CDSS, you have your measure definitions, configuration, and parameterization. So if you click on measure definitions, it's going to give you information about the measures. And then you can also link in different PDFs. So if this PDF is no longer valid, and maybe you want to link in a PDF that ECW provided on the support portal, you can always drop those in here instead. And you can edit these measures and document information here as well if you want. That just helps a little bit with identifying what those measures are and what you need to do. And then, of course, measure configuration. You can go in and enable or disable different measures so that they will report. This is mainly for your CDSS, for your alerts. So if you don't want to do cervical cancer screening, you can disable it, so it's going to disable your alerts for that. And if you go to measure parameterization, you can go in and set up the age range. So if you wanted to do colorectal screening at a different age than what they have listed, you can do that as well and set these up. So we'll just go to smoking status, and you can go in and change your measurement so that it's going to trigger it to go ahead and set that up. One other thing I do need to mention about the analytics and the PI piece of it, because there is a setup piece, and it doesn't apply to every situation, but I do want to mention where that's located. All right, so let's go back into the setup, and I want to show the PI settings. So if I click on the provider and I select PI settings, you have these two additional options here. So if this applies to your practice, you might want to go in and check these out, and that's where that's located. In case any situation where this applies, this is where you would locate these three options. Now, I mentioned something about the quality measures and how to view, drilling down into those measures a little bit too. So let's go back over to the quality measures, and I mentioned that you have all of these different red icons for different reasons. So 7-point cap. So that measures capping out. The outcome, intermediate outcome, it just indicates that that one is an outcome with an outcome, intermediate outcome. Inverse measure, it's hard to explain, but basically like the A1C, for instance, is an inverse measure because what it's looking for is not really a valuable concept. So like it's wanting A1Cs that are greater than 9%, but technically you want less than 9%. So that's the reason why it's called an inverse measure, because you want the patient to be less than 9%, but it's calculating those that are higher than 9%. So the value is going to be reversed. As far as meeting that measure is going to be better if it's not met, basically. You have your high priority. Those are the ones that are indicated with the asterisk that are higher level, high priority items that CMS guidelines would like. If you click onto the measure itself, you can drill down into the measure. You can go in and select different measures. I'm trying to find one that has some data there for us. Let's see. So you can see this one has one, but you can see that the performance is met, the status, it gives you the patient account number, so you can go and look. If it's not being completed or conducted, why is it not? If you had not met the performance met, you can go and look and identify why it's not being met by looking at the patient's account. From here, you can look at graphs, so if you want a graphical view of how you're doing with those measures, you also have the graphical view. And you can also see a graphical view from your quality measure, full measure page as well. And then how they're doing as providers. You can download this as a CSV file, which is an Excel file. So if you need to download this to Excel to be able to reflect on the data and compare it, you have that option and functionality as well. And as I said, you can drill down into any of these sections to see which patients did or did not meet that criteria. Now I want to say that's pretty much the basics of the MIPS dashboard and the setup. Caitlin, do we have any questions coming in?
Yeah, we do have a few. So
Awesome.
Just as a reminder, everyone use that question box on your panel and submit your question, and we'll get to those now. The first question I can see is, can an administrator see the dashboards in the provider hub of data across multiple providers?
Ooh, that is a good question. I know Meredith did the safety and compliance last week, and Therese is doing the other analytic training, the practice management analytics. There's some stuff there, and then the safety compliance has some stuff there for the admin side of managing the key performance areas. But as of right now, I don't think there is any way that I am aware of that you can see all the providers across the board on the provider hub. Because it's specific to that provider as they're logged in. Eventually, I foresee some improvement as time goes on, because it just seems like it's still in that implementation phase, and it looks like it's going to be a great analytical tool for the providers, But no, at this time, I don't think there is any way to view all the provider hub as a whole for an admin.
Okay. Another one of the questions that had came in was showing a path to get to something. So whoever had submitted that question, if you could maybe type back in specifically what you wanted us to show, because I'm not sure when that one came in. But those are really the only two questions that I can see right now.
Okay. I did just going on the path mention, and I will wait for that comment to come through as well. But I do want to mention when you're using the browser environment, like I typed in measures, for instance, and I was pretty sure it was in CDSS, but it's, you know, you look at so many things and they kind of blend together a little bit. So if you type in the part of the word, it's going to identify what areas match, what keywords match it. And then if you hover over it, you can find the pathway. So if ever you're not sure where the pathway of something may be, you just type in a keyword. I know a big one is for me is linking pharmacy. I can never find it. So if I type in linking and I hover over it, it'll tell me exactly where I need to go in the application to find it. So I don't know that that had anything to do with that question, but just talking about pathways and locating where that pathway may be.
Yeah, a comment did come in. It said it was to get to the mapping, but it looks like this person ended up seeing it. So I think we're all set there.
Yep, that one is under community and then mappings. But if you type in mappings, it's going to take you there. So, but yeah, it's under community and mappings, and then you have all of these here available for mapping. And again, I point out the report that I showed, the PDF I showed, showing how to meet the numerator and denominator, the exclusions. That data that you can find on your support portal is going to be really valuable to determine exactly what ECW is pointing to and what you need to map it to in order to meet that criteria for the mapping.
All right. Well, I do not see any other questions that are coming in right now. Tiffany, is there anything else you wanted to add before we close out the webinar today?
I don't think I think that covers everything as far as the basics of setting up the MIPS dashboard. I mean, it is super involved. There's a lot more that goes to it. The mapping is a huge piece of it. But as far as like the setup, the dashboard itself, navigating, you know, that's pretty much what we were trying to achieve today. And I hope I was able to accomplish that.
Yeah, thanks again for presenting. Again, if you have questions in regards to anything we've shared today, you can reach out to us on our website, or you can reply to the follow-up email that we'll send out later today with that recording. When we do close out, you're going to get a quick survey. If you could just take a minute to let us know how we did, we would really appreciate it. We use all of that feedback to build out future webinars like this one. So again, thanks for joining us. We hope you enjoyed today's webinar, and will join us again next week when we talk about EVO reporting and PM analytics. Until then, we hope everyone takes care and stays safe. Thanks so much.